Good afternoon, and welcome to HealthSystemCIO.com's All-Star presentation, Examining Data Governance as a Cornerstone of Quality Analytics, a webinar tweet chat combo from HealthSystemCIO.com, sponsored by OnBase by Hyland. Just a little housekeeping before we get started. My name is Anthony Guerra. I'm the editor-in-chief of HealthSystemCIO.com, and I'll be your moderator today. Our managing editor and director of social media, Kate Gamble, is hosting a tweet chat alongside our event. You can view it in the media viewer panel on the right-hand side of your screen. If you want to participate, you can do that on your phone or in a separate browser by using the hashtag HSCIOchat. And also, we will be taking questions, so you can do that in the Q&A box in the lower right-hand corner of your screen. You can send them in whenever you like. We'll take them later in the program. Just type them in and submit and leave the default set to all panelists. And you can see the URL for the deck on your screen. We've got it at the bottom of our slides, and it will also be sent out in the chat box. Just so you see how we're going to spend our time today, first we're going to hear from our good friend Chuck Podesta, CIO at UC Irvine Health. Then we're going to hear from Colleen Serhal, Director of Global Healthcare Consulting and Consumer Advocacy with Hyland Software, creator of OnBase. And then we're going to have our Q&A. So without further delay, I'm going to turn it over to Chuck Podesta. Chuck, thanks again for joining us today.
All right, thanks, Anthony, and thanks everyone for being here and taking time out of your busy schedules, especially during this holiday season. I'm going to walk you through kind of data governance from a UCI perspective, but also what I think from an industry perspective is probably some best practices that we're doing here, but we've also learned from others across the country. So first off, just a little bit about UC Irvine Health. You can see the data on the screen. We are part of the University of California health system, so there are the 4 other medical centers, UC Davis, UCLA, UC San Francisco, and UC San Diego that are part of the system as well. We are actually in the middle of a huge Epic implementation with UC San Diego hosting us at this point. So the data governance is certainly coming into play as we implement Epic across our organization. So first up, what I want to talk about is that data governance is not a religion. What I mean by that is there's not one way to do it. There's many, many different ways to do it, and I'm sure in your organizations you've tried different things, maybe successful, maybe not so successful, maybe you're still trying different things, but there is no one way to do it. There are a couple of options in my mind. One is that I've seen in other organizations. One is you kind of go, you look at data governance from the whole organization, kind of the big bang approach, big money approach. Maybe you bring in an outside consulting company. You start from scratch, and you're looking at data governance across all of your enterprise. And so that's certainly one way to do it. But I think if you're getting started, that's a really difficult way to go, because I don't think you're going to get any benefits for a long period of time where you're setting up that governance. I think that, the capital investment to do it is pretty difficult, and keeping people engaged and getting buy-in makes it more difficult because you're not seeing those quick wins. My recommendation is what I've seen that works well is you start with a small group in IT, working with a single business partner. Pick one, and begin defining the key processes, critical to the entire organization within that single business unit. An example of that would be the quality department, or quality analytics. Great place to start. There's a lot of rich data there, and there's things that are defined already, quality measures that are already defined, such as PQRS, meaningful use, HEDIS, and of course PRIME or DISRIP, depending on the states that you're in. These things are already either defined by the government itself or other organizations, and you can really implement the data governance within these areas a lot easier than trying to do it across the entire organization. So why do we need data governance? I'm going to try to keep it within the the quality analytics, just as an example, as opposed to looking at the whole organization. But basically, the business needs to define what and who is being measured across what time period in order to provide value and improve quality, if you're looking at quality analytics. So once the what and the who and the time frame is defined, we need then to find out where the data is and where it exists. And that's where the kind of the rubber meets the road. So for instance, for programs with similar measures like PQRS and MU, we found in our organization that the data documented in one place is documented in one place for PQRS and is in another location for meaningful use, even though it is the same particular measure. So it's going to be really important as which one is are they both the same? Are they both are they different? And how do we work towards defining which measure that we're actually going to use for both PQRS and meaningful use? And because we could document both locations in the data governance system, reporting for each program was enhanced based on doing that. So being able to centralize that data within a tool makes it much more easier to quantify. So the next slide is, this is probably what's happening in your organization if you don't have data governance, and this is just another reason for it. These are, typical questions that are being asked, by the receivers of the reports and the data and the dashboards that, when they look at it and they see something that doesn't look quite right, it's who approved this data doesn't look right, is this the right version of this field? Where's this data documented? A new diagnosis wasn't picked up in the reports, missing data. And this typically happens when the receiver of the data is looking at it and, it may not meet what that person's expectations are for the particular score, potentially. So they immediately start questioning the data, especially if it's something negative to their particular business unit. That's the first thing people do. It's natural. And so with data governance, you want to always be able to backtrack and be able to, sit with that particular user and go through, this is how the data was defined, this is where it came from, and the data governance committee was able to approve the way this was set up, so that it just makes for a more robust conversation and more acceptance of the data as you go forward. So, basically rule number one here is data governance is owned by the business operations and facilitated by IT. Really it goes without saying, yes, but it's, as we all know, a lot of things, even though we talk about business operations owning various aspects of IT, it typically falls to IT many times to take the lead. In this particular case, it's really important that the business operations, clinical operations take the lead on this. What IT does is we provide the tools. There are a lot of good tools out there that you can use in data governance. I suggest using those rather than an Excel spreadsheet or something like that. They're built in such a way to help you define, once you define what the data is and where it is, it can actually automate and update the enterprise data warehouse as well, so you can get rid of some of the manual processes. So it really creates the dictionary, an online dictionary, for the data governance committee to be able to use. Really important. And we use a tool here. There's many out there, but I would suggest doing that. So when you do set up data governance, again, business operations is going to own it. These are some of the roles and responsibilities that you need to include, from the business side of data governance. So, of course, you need the stakeholder, and as you're creating this data governance committee board, the stakeholders are made up of that business unit. So, for example, if you're doing the quality analytics piece, the stakeholder would be the quality department. Most likely the chief medical officer would be kind of the chair of this particular board if you're starting in that particular area. Again, you can see if you try to do the other option of looking at this across your entire organization, how difficult it would be even to define who the stakeholders were and how large that data governance committee could get potentially and unwieldy. So again, would recommend picking that business unit and focusing on that. So now you need subject matter experts within that quality department. These are the people who understand how that data is documented and potentially knows where the data is as well. The business analyst within that department, and they may have different, I'm calling them business analysts, they may have different titles, but these are the people that determine the appropriateness and meaning of the data in relationship to the measure. So they understand the measure itself and the data's relationship to that measure. And then you have the data steward, and this person is this person's really important to the process, really gets into the weeds, coordinates with the subject matter experts, coordinates with the business analysts. They're kind of the glue that's pulling all the the decisions together, make sure they're documented, disseminated, agreed to, and then also is the link back to IT to make sure that whatever comes out of the data governance committee is then reflected into the enterprise data warehouse through whatever tool that is being used. So you can see it's quite a bit of work on the business side. These are not IT positions, so it's extremely important that this moves forward with IT supporting it, and in my mind, that's the only way it will work. So let's talk a little bit about who is being measured. So you have, this is the first place you're starting. So you've got your committee together. Now you're going to take and you're going to look at who is being measured. So now you've got different things here. I've got some examples: all ambulatory patients, all Medicare patients, all managed care patients. So we're going to start there, within our data governance committee. So the first thing we're going to look at is the definitions. What does all ambulatory patients really mean for the enterprise? And when I got into this, I was kind of surprised. I was like, well, all ambulatory patients, anybody that came to our ambulatory clinics is an ambulatory patient. Well, not so fast. It can be, the definitions can be different depending on the organization. What we use here is it's 2 primary care visits in the previous 3 years is our definition of all ambulatory patients. Some other organizations that we worked with have 1 primary care visit in the current year. And then how do you define a primary care visit? Is that by clinic location or is it by provider type? So you've got to get down into that detail as well before you can define what all ambulatory patients really means. So without data governance, you can imagine, somebody writing a report that is measuring all ambulatory patients could be pulling data and not measuring, the right group of the right cohort group, I should say. So, this is kind of eye-opening when you get into the data governance. But once you define it and you use that tool to document it, now you have it. You have it for posterity. It's been approved. Now, when that links back, that automatically updates the enterprise data warehouse. Anytime somebody selects all ambulatory patients, they are going to get the 2 primary care visits previous 3 years by clinic location. And so everybody's agreed that that's how we're going to measure it. It's really, really important to do that, and you can't really do it without a data governance committee. And again, when you get back to the users of this information, you need to understand all that, because as the questions come in, as I said earlier, where did this data come from? How was it defined? It's my last bullet, it's very difficult to prove that the measure improved if you can't answer the simple question of who is being measured. Very, very important. Next up would be which patients from the population qualify for this a specific measure. So you're looking at all ambulatory patients. Now you want to take a look at an individual quality level, and so let's take a look at diabetes, for example, and you want to do some reporting on diabetes. So the measure itself, the importance here is that when you're looking at diabetes, PQRS may have a different definition than PRIME, which may be different than the local organizational definition as well. So again, you've got, as part of data governance, once you define that population, now you've got to dig in and say, okay, let's take a look at diabetes. PQR says it's this, PRIME says it's this, our local organization says it's this, and so you've really got to ferret through all that and define what the real rule is. And it could be different because you're reporting to PQRS and reporting to Prime. You certainly can't change that quality measure, but you need to make sure that you're reporting on the right one for that particular event. So for instance, for a diabetic patient, the definition always involves a designation by level of HbA1c, but that can vary from a 7 to a 9 depending on the source of the quality measure. So the normals and the abnormals can be different depending on that source. So PQRS is different than Prime. So for example, normal abnormal ranges can differ for the measure depending on the program. So PQRS certainly defines diabetes if you look at it differently than MU. So within your data governance, within your dictionary, you need to make sure that, okay, I'm creating something for PQRS, I need to use this data element found here versus meaningful use, I need to go somewhere else and look at a different data element, and it's all diabetes. So again, try not to get too much in the weeds here, but just to give you enough of examples to show the importance of data governance in the quality of the reporting and the accuracy of the reporting that you're going to produce in your organization. So again, your data steward, subject matter experts, business analysts, all working together, with IT and the correctness and appropriateness of the code sets being used. It's super, super important for accuracy. And you can imagine the organizations that don't do this well, how accurate is the PQRS reporting and how accurate is the meaningful use reporting? And if you ever get into, an audit situation, can you actually, defend yourself in that particular situation? So again, another important aspect of data governance. So now you defined your population. You've got your ambulatory patients. You want to look at a measure of diabetes. So now you've got to look at, okay, where is that data? Where can I find it? So, for example, a diabetic foot exam can be documented in multiple flow sheets within the EMR, since different clinics have different workflows. So if you haven't standardized on a single workflow, say, across all your ambulatory clinics, the data for a diabetic foot exam could be in multiple locations. So you've really got to go through all the data within the EMR, wherever the flow sheet data could land within the database itself, and make sure you're finding everywhere that diabetic foot exam has been documented. So otherwise, if you're just taking one flow sheet and looking at that across all clinics, you may miss, where it's been documented in other parts of the flow sheet. So that's really important. Also, if you're looking at billing data, that does not always capture everything and doesn't always reflect the complete clinical picture. So you've got to look, across clinical data, you've got to look across billing data, you've got to put all that together and do a thorough search around that. So that's really, really important. Again, the data steward is involved in this. That person's role, again, working with the subject matter experts, discovering those locations, documenting them in your IT tool, in your data governance tool that you've acquired. Making sure the data governance committee is reviewing and approving, and then the last level, the business analyst will also need to help determine that the data meets the requirements needed by the quality measures. So they're kind of looking back at PQRS and meaningful use and making sure that the data meets that. And a quick example of that would be, diabetics require a dilated eye exam. So in the documentation. So just an eye exam does not meet the criteria, for that particular test. So you're not only looking for an eye exam, you're looking for a dilated eye exam. So again, it's from the business analyst and the data steward working together needs to understand the rules around that and making sure the data is captured or defined and captured, appropriately. So keep calm, keep herding the cats. You can imagine, just the quality analytics, pulling this all together can be quite daunting. You need to engage, multiple subject matter experts to discover the various locations that the data is captured in the EMR and other databases. And that can be quite a process to do that. It's an iterative process, and you just keep refining it as you go along. Not quite sure whether the cats in this example or the people or the data or both, probably, all of it combined. And there will also, there will also be times, you probably run into this, where you have conflicting versions of similar data. And again, the business analysts and others who need to get involved to help decipher those conflicts and really understand, where is the source of truth for that particular data, and make sure, again, that's documented through the data governance tool and back into the enterprise data warehouse. Really important, and it's not easy work for sure. So you can see how the data governance it's really an ecosystem. To me, it's evolving. It's a living, breathing thing. It's never static. It's always changing as you're updating and as the rules change, as PQRS expands, meaningful use changes. Again, you've got to go back to the data governance committee and add those data elements and find out where that data is and document it. And so it's just and that's why we use the gears, because it's just to me it's a machine. It just keeps moving and it's never static. It evolves, gets stronger. It also gets stronger with every new decision, because you can imagine as you're adding these decisions to your data governance tool, you're creating a dictionary basically, and that dictionary gets larger and more precise, as you add more and more data definitions to it, and it becomes quite an important document, over the years as you go forward. So, and the value of the enterprise data warehouse is also enhanced. You can see the business decisions go into the data warehouse. It's enhanced because now it's increasingly well-curated data that's being loaded into that data warehouse. And then the data documentation comes back out and back into the data governance workflow. So again, it's kind of the circle of life. And again, and by taking that minimalistic approach to data governance, the organization, we were able to rapidly define key concepts that require governance and begin to define the critical processes needed to govern them. And so you start small with that, and then because you set up that process in such a way, it becomes very scalable. So now once you work through your quality organization, if that's where you choose to pick, and now you can move on to other parts of the organization using the same processes, the same data governance committees, maybe different people involved, but the same rules, the same tool sets, all those kind of things can be scalable, across the organization using your quality successes as a way to build success across the organization. So really, as a result of this data governance process, your reports, your dashboards more accurately reflect the business truths and are used to make more effective decisions to improve quality of reporting, and you can see ultimately the quality of care delivery. So without this, I think you have reports, you have data in the reports. To me, if I walked into an organization that did not have data governance, I would be questioning the results of those reports all the time, whether it was a dashboard or whatever it might be. To me, without data governance, it's hard to say how accurate the reports are in your organization that you're producing. So I'm going to stop there and turn it back to Anthony.
All right, Chuck, thanks so much for that excellent presentation. I'm looking forward to our Q&A. Just want to remind everybody to go ahead and send your questions in the Q&A panel and leave the default set to all panelists. Before we get to our Q&A, we're going to hear from our sponsor, OnBase by Hyland, represented by Colleen Serhall. So, Colleen, thanks so much for joining us today, and we're looking forward to hearing from you now.
Thanks so much, Anthony. All right. So, Austin, hold on 1 minute. I just want to make sure that I can advance the slides here.
I can forward them for you, Colleen, if you need.
That would be great, Anthony, if you could go to the first slide.
Let me take you there 1 moment.
Sure. So while he's taking control, a lot of people ask, well, why is this such an interesting topic for Hyland Software to sponsor and share this information? And I'll tell you, as a manufacturer, a producer of content management, and with a focus in healthcare, we find that data governance tends to be one of those conversations that's really focused around the EMR, but really plays into so many components overall of the HIS system. And I think Chuck did a nice job talking about not only the process of looking at other places in the organization and how important it is to bring those together, and the reference around, looking through nursing notes and looking through that data and how that comes into the system. Very often within our customer base, we find that data that needs to be looked at to get that holistic picture of the patient is data that might be in some of the historical information housed in the HIM department. It may also be sitting in some of that unstructured content that's sitting around the organization. And so we really feel like being able to bring all of that information into one repository and then feed that up to the EMR and thereby to the data management system is really a key piece of where we play in the infrastructure. Next slide, please. For those that aren't familiar, OnBase is a content management system. It's a single platform and really comprises a couple components of a tool that's used across the enterprise. So from work view to business process management to capture to sharing filed information, and whether that's accessed on mobile devices or at a desktop, what we're trying to do is gather up that unstructured content. It might be in images, it might be in data that's sitting in different components of the organization. We start to, while our conversation today has really been patient-centric, we also have a large footprint in the administrative pieces of the hospital organization. We really see the future as, if you can go to the next slide, Anthony. The future is really bringing together all the big picture across the hospital enterprise so that we start to drive productivity, so that as we're looking at patient-centric activities and the outcomes related to how we deliver care, as we look at how we help our hospital customer partners run their organizations with more effectiveness, as we look at enhancing the patient experience, we can help feed some of the manual activities that happen today that may not live in a certain system of record, bring those into the systems of record and really help drive efficiency. Next slide, Anthony. And, I think it's important just to reiterate, I think Chuck touched on so many components within certainly the EMR experience and the other ancillary systems that feed into that. What we want to remind folks is, the data governance conversation, looking at the taxonomy that's needed from all of the supporting infrastructure and systems is really important. So whether we're looking at patient record, whether we're looking at VNA, whether we're looking at, other products that, we want to drive home the idea of a holistic view, trying to feed that data so that we can ultimately impact the health of our communities. And that's it.
Very good. Well, thank you so much, Colleen. If you want to hang around for a minute, I might ask you to comment on the Q&A. So now we are ready for our Q&A. So as I mentioned, go ahead, send those questions in and we'll take a look at them. I'd like to first talk to both of you about this concept of finding the data and finding where it is. And let's start with you, Chuck. I would imagine this can be kind of an interesting exercise for a CIO who maybe is new or maybe not, but who thinks that they know where all the data is or even all the applications that are being used, but finds out that things have been purchased they didn't even know about and data's in places they didn't know existed. Is that something that can happen when you do this exercise?
Oh, absolutely. And especially in organizations where you've got multiple systems, a best-of-breed type of organization. Here, I mentioned earlier we're going to Epic. One of the reasons is that that helps really standardize, where the data is. Right now we have Allscripts, we have Siemens, we have GE, we have a variety of different systems that house a lot of a lot of data that's similar or even the same, and it makes it very difficult for our subject matter experts, our business analysts to find where that actual source of truth is in those various systems. And the more that you add to that, whether the departmental systems, it makes it very, very difficult to do data governance, but then also to have a very accurate enterprise data warehouse, depending on where all that data is coming from. So we've had to do a lot of work here on that. We're hoping with Epic we can simplify that a bit, because more of the information would be housed in one system as opposed to spread out across the enterprise. So absolutely right.
Colleen, what are your thoughts around that type of exercise and the information it can yield, sort of the side benefits?
It's absolutely critical, and I think something that a word that comes to mind is trust. So when you're going through the work that certainly that UC Irvine's going through, that so many folks are going through, the end users, whether those are physicians, nurses, whether they're the quality staff, auditors, they need to have trust in the data. And going through these exercises will ensure increased quality, and it will build an environment of trust. So many times I go into organizations where they're working to move off of their sort of best of breed onto more centralized, and it's one of the things you kind of lift up the rock and things crawl out from under it. And so many conversations I have to have with IT leadership, because I think, as Chuck articulated well, they're a facilitator of this, right? And trying to help the departments go through these exercises, and but it's just key. The outcome and how well things happen down the road, years down the road, is really tied to that data governance activity in the beginning.
Chuck, you mentioned that if you were to look at an organization and you did not see data governance process in place, it would certainly concern you. The quality of the output, the reports, is something you would not have a lot of faith in. So aside from a lack of data governance, when you think of poor data governance, can you give us some idea of a process you could look at and say, yeah, I get this, I've seen it before, but this has problems in it?
Yeah, I would say, an organization that's taking the, trying to do this holistic approach where they're trying to do everything, where they hire this big outside company to come in and set up this structure, and they're going to look at data governance across the entire enterprise as a start. It just takes so long to set something like that up, and so costly. And to me, it's not going to be as accurate. It's kind of like if you're going to build a dictionary of terms, you don't want to start with trying to create the entire dictionary. Maybe you start with the letter A, and then you go to the letter B, and all the words that have start with the letter B and then the letter C, and you build your dictionary that way as to try to build A through Z all in one fell swoop. You're going to miss things along the way. There's too many people involved, and it's too much of a daunting task. So that's what I would look at as somebody who's doing that type of process. It's going to take years for them to see the fruits of that, and also I think it's not going to be as accurate as the incremental approach.
Colleen, any thoughts on that?
I agree, and I think it's also important from a vendor point of view to, have the vendors talking and have the vendors communicating, because while, the health system is making those decisions, I think it's imperative to have vendors that are going to be there to support the activities going on.
Yeah, and I would also say like an IT-led process too, Anthony. If I walked into an organization, it was chaired by the CIO, and it was all IT people on it with a couple of analysts from the department, something like that. I would be suspect of that type of process as well, because again, as I said, it needs to be driven by the business. And in the quality's case, if the CMO wasn't chairing the committee, I'd be concerned.
All right. right, very good. Next question or comment from the audience. There should be no IT systems built or purchased without a functional capability portfolio and enterprise portfolio governance. Speak truth to the issue that clinical departments should not have independent IT system purchasing capability. Chuck, would you like to speak truth to that concept?
Yeah, I couldn't agree more. I'm in lockstep for that. It's, yeah, we've actually had the, the other thing you have is you have, physician departments as well. They have, separate funds coming from different areas, and they, go to some conference and see the latest, greatest tool, and they, they try to purchase it behind the scenes, and then we find out about it later. That sort of thing happens all the time. But you have to, what we do, I mean, we work closely with our procurement department, supply chain procurement, and we put a lot of different steps in place to make sure that if they receive something that looks, smells like IT, looks like IT, that it immediately comes to us to go through that process, before it's purchased. That hasn't always happened. Large organizations, it's tough to do, but you've got to have that in place. I totally agree. Otherwise, now you're collecting data that hasn't gone through that data governance process, and you're reporting on it somewhere, and who knows the accuracy of it.
Colleen, any thoughts?
I think it's the ideal. I'll tell you from my experience on the vendor side, we regularly have very difficult conversations with organizations who come to us without the blessing and executive support of the CIO. And we'll just say, what you want to do, yeah, it's right, but it needs to be led. And I think back to the data. There's automation of a department, but ultimately why we're doing all of this is to get to the data and get to the better outcomes and really change our clinical practices and drive efficiency. And so if these things aren't unified, it's the money's probably not worth it. So I know our perspective as a vendor is different. People are always surprised when we just say this isn't the right project for us. But I just think as part of the ecosystem, we all have to be on the same page that and really help drive this idea that there needs to be a single kind of decision force driving this, and it's IT.
Very good. Another question in the same line. I think we really hit a nerve with this kind of topic. Chuck, what is your approach to standardizing data when there has been a legacy of department/service line autonomy?
Well, through your IT governance, I mean, that's a whole separate webinar we can talk about, but you really have to have strong IT governance so that you don't have those types of systems coming in. We have here, governance at a lower level, clinical and financial, that handles enhancements to systems and things like that. We actually have a data governance, of course, group as well as part of our IT governance. Anything that costs over, $250,000 has to go up through IT governance, and the business sponsor needs to come in, and after the IT has done the vetting, it needs to come and present that, and we have a scoring mechanism and everything associated with that. A lot of the vetting has already been done. Does it fit in with our architecture model? What about security? And then also, linking in with data governance. All those things have to be done ahead of time. Then that particular program or project can come forward to the IT governance. And again, that's a multidisciplinary group. I don't chair it. It's actually chaired by a senior leader as well. So to me, if you don't have that in place and it's driven at the very top, then you'll have these particular products finding their way into your organization. So again, back to IT governance.
Very good. Next question, Chuck. Speak to the relation of data governance to functional or workflow governance.
Yeah. So let's see. In the ambulatory, let's use the ambulatory example. Again, actually I'll use the workflow example, the worksheet example. you've implemented, say you've implemented Epic or pick your system in your ambulatory environment, your EHR, and you're designing that now. Without thinking about data governance, what you potentially do is go clinic to clinic and let them create their own workflows, their own workflow sheets that matches their workflow within their particular clinic. And that may be great for that particular clinic, but it's tough it's bad for the enterprise, because when you go back to your data governance, if you've got 30 clinics with 20 different flow sheets and 20 different ways of collecting the information and storing the information, it puts a lot of pressure on your data governance, and then be able to pull that together, figure out where that data is, making sure it's accurate, and you've got all the data, and then getting that data into the data warehouse. So data governance needs to be really part of the implementation, and being able to ask the question, geez, could we have just one flow sheet, or could we have 2 flow sheets instead of 25 flow sheets in a particular area, and really ask those questions, and hopefully be able to convince people by doing that. Maybe you give a little bit up on your workflow within your clinic, but you're adding value to the enterprise by having much more accurate data and data that's easier to find.
All right, next question. How do you deal with the gray area between diagnostic equipment and information systems? For example, a clinical department may want a particular system because of its clinical/diagnostic capability, while IT may oppose it because it uses, quote, end quote, the wrong platform.
Again, that for us, that's our IT governance. Anything that's over $250,000. Now, what happens with diagnostic imaging? The equipment itself may be it's definitely over $250,000, but the IT aspect of implementing that. Now, the diagnostic equipment certainly wouldn't come through IT governance. Again, there's other committees that are looking at if you're going to purchase a CT or whatever it might be. But we are involved from the standpoint of the architecture and the security, and implementing something like that is going to be more than $250,000 in services and support and things like that. So that part of it would still come through IT governance, and we could oppose it from the standpoint of architecture or security or any one of those items that's not standard. Hopefully, though, in your organization, that through your procurement in your supply chain, there's strong standards in place that when you're buying the piece of equipment, that there's maybe you've done a deal with one vendor, or there's 1 or 2 vendors. There's not 10 different vendors that can be that the clinician can look to acquire something from. So again, I think some of it's IT governance, some of it's your procurement to be able to manage that.
Maybe we're going to have to do that other webinar on IT governance.
Yeah.
We'll look at that one. Colleen, let me start with you on the next question, then we'll go to you, Chuck. To the point of where to start, given the shift from pay for quantity to pay for quality and the reality of multiple HISs within an organization, please share your opinion on focusing data governance on clinical documentation improvement of primary measures. Colleen?
Sure. I mean, I think
easy one.
Yeah, thanks. I'm going on PTO tomorrow, so throw the tough one at me.
That's right. That's right.
I think having been in this industry for 25 plus years, it amazes me that we still haven't figured out how to make this happen. Right? We've seen this evolution of certain clinical systems and the movement from paper to electronic, and it's really tough. What I can tell you is that, from my experience, that the organizations that do this best have clarity coming from the CIO about what the goal is. And that goal then has been sort of perpetuated down to the key areas that are not only creating the clinical documentation, but also managing that documentation. And people are looking at, through their different governance committees, and it's different everywhere. In some places you still see those old forms committees as an example. you know, in some of the, you know, clinical nursing documentation committees. In other organizations, you know, they've really have moved those conversations more to a data-driven model. Depending on where your organization is, kind of in this spectrum, I think a couple key things. One is partnering with your vendor, because every vendor, you know, so whether in the case of UC Irvine, you're moving to Epic, you know, they have a particular model and philosophy around this. You know, Allscripts has a slightly different one, Cerner has a slightly different, but really partnering with your vendor to understand that and look at the structure and the model. Then I think the second piece is really encouraging your leadership to go out and understand what the themes and conversations are. So all the professional organizations are really doing a great job of bringing webinar content to their various professional groups. AHIMA, I was with HIMSS last week with their Chief Nursing Officer group, and they're having the same conversation. Chime's having the same conversation, but really, you know, starting to get people educated, because you can't even start the conversation until people are on the same page with what needs to be achieved. From there, you can start to look at moving from these best of breeds and starting that mapping activity and coming up with that sort of standard taxonomy that needs to be in place. Chuck, you're doing this now, sure. I'm sure.
Yeah, no, so I would say, you know, starting quality, you know, as I mentioned earlier in the webinar, starting quality I think makes, you know, a lot of sense based on that question, because, you know, we're a value-based care world, everything's moving to quality, patient safety. So starting there makes that, again, just makes a whole lot of sense to me. And your data governance can actually find your best practices. You know, you can find, you know, who's documenting the best on these particular measures. You know, whether it's physician, nurse, whoever it might be doing this type of documentation. You know, data governance helps you with your business analysts, looking at the data, where the data is, who does that well. Could be a particular nurse unit, particular clinic, particular physician groups, even down to a single physician, and really find out, you know, how they do that, and because it is a best practice, and then pull that out and try to then move that throughout the organization. Again, I think that's the role of data governance as well, is to get people to understand, hey, if you document in this way, even if it's a different system, you know, we're going to be able to capture this data and provide this information back to the enterprise in a much more accurate way. So I think data governance can play that role as well.
Very good. Well, that's about all we had time for today. Really an excellent conversation and a lot of interaction with our audience, so I think good appetite for this information. When you close out your WebEx window today, you'll be taken to a post-event survey. If you could answer a few questions for us, we'd appreciate it. I want to thank our good friend and speaker, Chuck Podesta, who is very generous with his time with us, and we appreciate that. I want to thank our sponsor, represented by Colleen Serhall, and it's OnBase by Hyland. You'll receive an email when our archive recording has been posted to our YouTube channel. For those of you with continuing education interests, if you have the Chime CHCIO certification, attending our webinars gets you 1 CEU. We'll let Chime know you were here, and if you've asked us to do so, we will. If you need a general certificate of attendance for another CEU program, you can use the final slide in this deck. If you would like us to produce a webinar for you on the topic of your choice, you can contact Nancy Wilcox, and you can go to our website to view our upcoming schedule. So with that, I want to again thank Chuck, Colleen, OnBase by Hyland, and our attendees. Everybody have a wonderful day. Thank you.